Hi everybody, Dr. Mike here, retired pharmacist, and welcome to my channel. On my channel we discuss drugs and nutrients, drug-nutrient depletions. In other words, there are certain medications depleting nutrients in your body that can cause a problem. Or we also look at certain drugs and do they interact with any kind of supplements. So today we're going to talk about statin drugs. And if you've not heard of a statin drug, you've probably been asleep for 20 years. Statin drugs, as you know, lower cholesterol levels. Now, whether cholesterol levels need to be lowered or not is a whole different debate, and we're not going there. We're just going to talk about the drugs. So some of the names of statin drugs, in case you're not familiar with them, are, I've got a list here: Mevacor, Symbicor, Lipitor, Zocor, Crestor. Anything kind of ending in or is a statin drug. And the statin drugs, what do they do? Well, they inhibit the synthesis of cholesterol. Do they deplete anything in the system? Yes, they do. They deplete an enzyme called coenzyme Q10. By inhibiting the synthesis of cholesterol in that same pathway or reaction, they also inhibit the synthesis of coenzyme Q10. Now, what does coenzyme Q10 do? It's involved in energy production. That means that it helps the cells produce energy. If a cell produces energy, whatever that cell is going to function better. So it mainly depletes the coenzyme Q10 in like muscle tissue, nerve tissue, heart tissue, and it is possible that the side effects that we see from statin drugs could certainly be coming from a depletion of the coenzyme Q10, although this is not actually proven. So what are some of the side effects? Well, if you're taking statin drugs, the first thing I would say to myself is if anything weird started happening to me or I started experiencing after taking the statin drug, then no matter who's telling you what, common sense would probably tell you it's from the statin drug. But most of the common things that people and I've seen experience are pain, like muscle pain. They can actually cause muscle damage, which is not good, but muscle pain, certainly confusion, mental problems, depression, vision. I mean, these are things that you would know as a side effect once you started taking those drugs. Now, of course, they can cause liver damage and kidney damage, but you wouldn't know that unless you were having some test done by a doctor. It can also affect insulin. They can make insulin not as effective it is, and somebody could be diagnosing you with type 2 diabetes, and it's really just from the statin drug. But so those are some of the more common side effects. But again, I say if you start taking one and you start feeling, your nose grows twice as big like mine does, then it's probably due to the statin drug. So, all right, what can we do about it? Well, take the coenzyme Q10. I mean, it's worth a try to take that to see if those side effects seem to improve. And if they do, then great. And if they don't, then it's not the coenzyme Q10. How much should you take? Well, probably about 100 milligrams a day. It should be taken with food because it is a fat-soluble substance, which means it's better absorbed in the presence of food. And there's different forms of coenzyme Q10, which can lead to the confusion. There's coenzyme Q10, and its active form is called ubiquinol. So at least what I would say is if you can afford it, because the ubiquinol is going to be a little bit more expensive and you're pretty old and your system can't convert things into their active forms as much as they did before, I would go with the ubiquinol. But if not, do the coenzyme Q10, and certainly within a month, 6 weeks at the most, you should see an effect. And once again, take it once a day, preferably in the morning with food. Okay, so there's also some information that the statin drugs can deplete vitamin K in your system. Now, one of the things that vitamin K does, especially vitamin K2, is that it prevents calcium from building up in the arteries, which leads to plaque. So again, I don't, there is a test that you can do to determine calcium in the arteries, and doctors would know about that. So if that was the case, I would certainly recommend you take vitamin K2, maybe anywhere from 50 to 100 micrograms a day, although there's not been any. The body normally makes about 30 or 40, or gets it from food, I can't remember, but around that dosage range would certainly be enough. And again, that probably should be taken just to begin with to help build up or prevent plaque inside the walls of the arteries. Okay, so does it interact with any supplements? Do statin drugs have any problems with supplements? Well, probably the most common one that everybody, well, I don't know if everybody, but doctors and pharmacists, etc., would know about is grapefruit juice. Grapefruit juice, because of certain compounds in it, can cause increase in blood levels of the statin drugs, which could lead to more side effects. So is that important or not? Well, the studies they did with it, they were drinking like a quart of grapefruit juice a day. So common sense would tell me, okay, if you got to have grapefruit juice, that's okay, but maybe just make it 2 or 3 or 4 ounces. Don't drinking tons of it, because that's where the problem lies. So yes, it can be a problem with grapefruit juice, but I don't know too many people that just drink grapefruit juice or eat grapefruits. Green tea. Now again, green tea is certainly healthy for you, but it can affect the absorption of statin drugs, particularly just one called atrovastin. I can't even remember how to pronounce it, but that's a simple situation. I mean, if you're taking that drug and you're drinking green tea, just don't take them at the same time. Take the drug at some point in time and wait an hour or two before drinking the green tea, because they both won't be in the stomach and the intestines at the same time. So I don't see that that's any kind of problem at all. Ginkgo is an herb that is supposed to increase the elimination of statin drugs, but I don't think there's been much proof in that. That's not something I would be too concerned about. And then black pepper can increase the levels of statin drugs, which you can a lot of things too. But again, I mean, you'd probably have to be eating a lot of black pepper. So the only one I would really be concerned with would be the grapefruit juice if you were taking a statin drug, and you might want to limit the amount of grapefruit juice that you're taking. Okay, so that's it. I hope you got a little information today. If you have any questions, I'll put my email in the description, and or you could drop a comment. If you like the content and you want to hear more about drug depletions and drug interactions with supplements, then please subscribe to my channel. Hit a like. I think you can hit a notification which lets you know when I put up a new video. And again, drop a comment if you have one. So thanks for watching, and hopefully I'll be posting at least maybe once, twice a week. And if I get any comments, then we'll take a look at those drugs, and if not, I'll just move on to the next popular one. Okay, thanks for watching, and always remember, peace.